all of us want to live long, including myself. And I also think personally for me, my own father died when I was very young.
Towards the end, you're still as healthy as you are.
You just have a very good trajectory, and then when it's time to go, you just go.
Do you think it's possible for someone to live up to 120?
All of us want to live long, including myself. And I also think personally for me, my own father died when I was very young. So to me, I keep thinking, what else could have been done differently? And I'm also, of course, worried, right? I have his genes. So does this mean that that's it for me? Is this my fate? And I was brought up by my grandparents, and they're now in their 90s. And of course, I want them to have the best life, right? So this whole topic is very near and dear to my heart.
Can you also share a little bit about your research clinic?
First, I want to dispel any myths about this longevity clinic, because I think based on the patients that have come, and of course you can see it on social media, people have so many varied ideas of what exactly is a longevity clinic. And also, within the healthcare, there's so many misconceptions. But I guess because it's a new field, right? So some people think it's like that Shen Dan, right? I want to live forever. And it's something humans have been doing like from ages, right? You read the history books, the emperor sends out the men to look for that pill. But that's not what we are trying to do, okay? I think a lot of people think, oh, this is the clinic so that I want to live forever. I want to be like that influencer who says that he's younger than what he is. Really, our focus is to help people to live a very good long health span, not lifespan. And I think you must have heard the word health span, right? It's being thrown everywhere now. It's like a buzzword, like how long you are actually living healthy without all these comorbids. So I think if you take the average person, let's say your lifespan is about like 80 something, 85, whatever, and usually by 60s, right? That's when they find out they have all this chronic disease, and then they start taking all these pills. So it's almost about like 15 to 20 years with comorbidities that someone has to live, or you become more dependent on others. So what we are hoping to do is to try to close that health span to lifespan gap. That means instead of like 60 to 80, like 20 years of living with chronic disease, we ideally want that to be like, 1 year or even less, like you just have a very good trajectory, and then when it's time to go, you just go.
So towards the end, you're still as healthy as you are.
Exactly. So we want to compress all that morbidity, and so that people live like in their full functional capacity. Like for me, I want my grandparents in the 90s, right? I want them to be able to still go on a holiday, to be able to walk in the airport, to be able to at least carry something. Yeah, so that's what I hope for.
Do you think this is achievable?
Yeah, I think so. I don't think we're not saying, okay, I want the whole population to be 120 years old, or we're not talking about pushing the lifespan at this point. We're really talking about increasing the health span. And I think based on what we see every day in our clinics, I think that's very achievable. The clinic is really not very different from, say, an ideal primary prevention, screening clinic, right? So I think we are all very familiar. We first come in and then we see the physician. They take a very thorough medical history, but I think the difference is that our physicians are trained to be extremely thorough. They care really a lot about your sleep, about your Apple Watch or your Fitbit, all that data there. We care about it. We care details about like your nutrition, what you eat at this time and this day, or about your family history. So we really leave like no stone unturned. We really, really go deep to find out about the patient. So the consults usually take a very long. And then, of course, we try to find out the person's risk factors and what their health concerns are, like what even brought you to this clinic. Here's your goal. Maybe you want to run, you're 17, you want to run a marathon next year. Or is it like myself, I have risk factors, I'm worried something's going to happen to me. So we try to make sure we address all these concerns. And then they go through a series of tests, right? So similar to, I guess if you go for a screening package or whatever, they usually have a series of tests. But we try not to just throw tests, without being targeted. And of course, everybody likes the idea of biological age, right? So that is really where I think it's still in the realm of research, like giving you a biological age based on your blood DNA methylation. So it's sort of like, what that means is we're just looking at what lifestyle environment has sort of done to your DNA. So we can measure that, and there are tests out there that sort of tell you how you fare relative to the general population. So that's biological age in a nutshell. So these are some of the tests that we do, and then the patient comes back. We have all the results. So before the patient comes back, we actually have a multidisciplinary team. So this would encompass people who are exercise experts, like exercise physiologists. We have scientists from like NUS who join us. We have our physicians, our health coach, our nutritionist. So we all come together and we really try to identify what areas that we can try to optimize in this individual. And if, let's say, his or her biological age is older than what his chronological age is, then we try to see which area is the deficit in, and then we try to work on that and come out on a very personalized plan for that individual, and then we deliver it to the individual. And then over a period of time, we will then invite the individual to come back and, of course, reassess, right? You want to see this intervention work, what other areas do I need to work in? So I think it's a fusion. It's like a screening clinic, but then really in terms of a multidisciplinary kind of setup, probably you only see that in more like advanced disease, like imagine you have cancer and there's metastasis everywhere, then you have a multidisciplinary team, right? Or perhaps in a geriatric clinic, right? This person has multi-morbidities and people come together and try to optimize that patient. But to us, our view is, why do I have to wait until that stage? Let's try to optimize in a multidisciplinary way. People who have experts in their relative field come together and try to provide the best for you.
Like you say, a lot of people are trying to achieve this healthy longevity, and some social media,
Yes,
they also talk about eating a lot of supplements, pills.
yeah.
Do you think we should take supplement for this purpose, or?
So I think that's not the focus of such a practice, but I don't know, is it just because people like that one pill concept that just, like I told you, that Shen done, right? It's just one pill and I don't need to work hard and that solves all my problems. You see it in your normal clinic as well, right? They'll tell me, doctor, just give me a pill so that I can lose weight. Or cure this, cure that. So that's not the focus of our clinic, and we do not routinely prescribe supplements unless, clearly there's some form of deficiency. And it's more of, most of the time, they come to us with like their list of supplements they're already on. So it's very interesting because people are really reluctant to take medications, but they are really open to take supplements. And some of these capsules are really big and they're fine taking it. So what we focus on is actually really understanding, like, why are you taking this? What are they trying to understand what they're trying to achieve from this, and explain to them, what potentially this compound could do, what are the risks versus potential benefits, and letting them know often this lack of evidence and lack of regulation in this whole supplement field. And then at the end of the day, really, it's up to the individual.
Can you also share a little bit more about how do you take care of yourself? I always love to ask this, especially people in your field.
Well, so I have to practice what I preach, right? So I know I've done my tests. I know sort of where my baseline is, and I think it really starts with awareness, right? I have not done extensive tests. I don't do whole body MRIs or anything like that, but in terms of my blood works, because I have family history, it's not the easiest thing sometimes to know where you are, but then at least you can do something and try to work on it. So that's one. And then two, of course, my diet, and also being the woman of the house. I think that's where many women, their role is, right? Because you're the one who usually does do the groceries, so you can sort of dictate what we are going to eat, and that's going to be more plant-based. But that's not to say that I don't eat meat. I still like my steak here and there, and I still eat a lot of good protein still. And then in terms of exercise, that's a challenge for everybody working, right? And then especially when you start early. So even if I'm really late, even if it's just 5 minutes of just stretching, I'm going to do it. The point is I don't want to break that cycle. If I miss it, once you just miss it, then you're more likely to, it's just so likely to accumulate and snowball, and you're just going to let go. But generally, I try to do minimum 20 to 30 minutes of some form of something I can do on the mat at home, because it's really not realistic for me to run to the gym. I know some people can wake up at 5 a.m. and then go for their 1 hour gym session, but I don't have that capacity now because I've got a small kid at home.
In terms of public awareness, do you think Singaporeans are there yet? Understanding of what you guys are doing?
I think it still could be improved on. Most of the people know what's on social media, and to us that's always a challenge, right? Because you have these millionaires, they go and do plasma exchange, blood exchange, and they do all these kind of things, right? And then there's this cold baths. There's just so much hype out there. So I think that there's a lot more that we can do to try to educate within the healthcare provider side and, of course, to the public.
Actually, longevity. I've been thinking about this for a while. It's been a pursuit for Chinese.
Yeah.
For over thousands of
Yes.
years, 2,000 of years, starting with Qin Shi Huang, looking for 长生不老. Yeah, like you said, the Xian Dan.
Yeah.
So are there any things that we are also using from the TCM part?
Not actively, but I know some people would. There will probably be some compounds, right, in the supplements that people are taking that have overlap with TCM, that have overlap with the Ayurvedic medicine, for example. So, but we are not using any of these compounds. Our focus really is on being very precise about and very intentional with regards to this whole exercise component and their nutrition and their sleep, because these things work and they are cheap and they are free.
So one of the questions I really want to ask, do you think it's possible for someone to live up to 120?
Well, there is someone who lived I think somewhere from the West, right, lived up to about 120, but that's not the norm, right? I think there isn't even a country where you have 50% of the population above 100. So we are pretty far from that. I know people will say, well, just look at the past, right? People used to live at their 50s, 60s, and in the last few years, suddenly, people are living to their 80s. But I think a lot of it has got to do with now, we have sufficient food, we have a roof over our head, we have clean waters, we don't have war, we have good governance, we have healthcare right at our doorstep. So all these things help us to so-called reach our potential. So obviously infectious diseases that used to be number one killer, that's not a problem. Now it's chronic disease, right? So I think perhaps the next breakthrough would be when in terms of neuroscience, the scientists who are working in terms of the molecular and the biological studies of aging, if they have some breakthrough there that can slow down aging, then maybe one day, but at this time point, I don't think it's going to be mainstream. And even if for us Singaporeans, I think more and more people will be hitting 100, but that doesn't mean that our health spans are necessarily increasing. We just many of our older folks can keep going on, right? Because we have we have abundance of caregivers. Maybe because our country is small, if you have any problem, you just call your relative who's just 20 minutes away or 30 minutes away, right?
Currently, I think our current figure is about 10 years gap between the health and lifespan. So do you think there's a way for us to push it closer to in the near future?
I think so. I definitely think so, because I would say just from like our clinic practice, I would say pretty much at least 90% of the patients that we see, there's still something that you can optimize.